Hi, I'm back. This is Paranda, and for those of you who don't know, I had a very severe ankle injury about 7 months back and had to undergo a surgery for the same. I was immobile for almost 3 to 4 months and then slowly progressed into weight bearing with using my boot, crutches, walker, and finally 7 months post surgery, I am walking pretty confidently now. Multiple people have asked me several questions regarding my journey towards healing myself, and I would like to address two main questions today, and most important. One is, how did I learn to walk again? Was it scary? How did my leg take the weight of my body after being immobile or not being on a weight bearing stage for months together? Wasn't afraid that I will fall. Um, and second important question, which people still ask me, is how did you prevent a limp? And how do we learn to walk again after an injury without limping? So this is the two common things that we're going to address today is how did I learn to walk again and how did I prevent a limp? I'd like to make it clear this is specifically based on my experience. It does not replace any medical advice, and I would request you to first talk to your medical advisor on how you should be going about your injury. This is just my hints, my experiences, which I'm sharing with you. So there's one thing that I would like to emphasize upon, and it's extremely important, is don't be in a hurry. Don't be in a hurry to put 100% weight on your both the legs till your medical practitioner has given you full permission. And even after that, listen to your body. Your doctor might tell you that you can do it now. Doesn't mean you have to rush through it. Listen to your body. Follow a process. And most important, don't be in a hurry to ditch your walker and crutches or even a walking stick. Using these aids is not a sign of weakness, but it is a sign that you are taking your time, and it's better to take your time and not develop a limp, because once you develop a limp, it is very difficult to undo that and learn to walk straight or without a limp again. So don't be in a hurry, take your time, follow the process, and heal yourself one step at a time. So what I'm sharing with you today is based on the advice given to me by my orthopedic surgeon and also my experience as a yoga instructor. So I was still not given permission to put full 100% weight on my legs, but I was told to start putting little weight. So how did I start? So first is putting both my feet down on the floor without any footwear, and just getting the sole of the foot of the injured leg used to the surface, because remember it's not put its and it's forget putting weight, it's not even touched any surface for the last 4 months. So slowly getting the foot to get comfortable with touching the floor, and then gently leaning a little forward and putting a little weight on it. And most important thing is you have to understand that so far our center of gravity was on my left side. Everything I used to shift my body to the left because my right is the injured leg. And now I have to learn to shift my center of gravity to the center on both the legs. So ensuring that both the legs are taking equal amount of weight, even if it is just 10% of my total body weight, just taking equal amount of weight and so I did this about 4 to 5 times every day for about a minute, just centering myself and ensuring that my injured leg gets used to the surface and also used to taking some weight. So this was the first thing that I did in the process of learning to walk again. After slowly starting to get my center of gravity in the sitting position, we now move ahead, and the doctor, my orthopedic surgeon, gave me permission to stand up on both my legs. So this also very patiently with support, stand. Okay. And now again, remember your center of gravity so far was your non-injured leg. So center it and start to slowly put equal amount of weight on both the legs. And my back of my leg is still touching the chair just for some support, and I'm putting equal amount of weight on both my legs. I'm not walking, I'm not moving, I'm just standing. And again, I did this several times a day for a minute, 2 minutes each, slowly increasing my capacity every day. Simple, equal weight of your body on both the legs, allowing the sole of my injured leg to get used to the weight without any movement. So this is the second step that you will do to ensure that you learn to walk in a systematic manner. So after just practicing to stand with equal body weight on both the legs, we move on to the next step where we start to put a little more weight on the injured leg. So far our body weight used to be predominantly the non-injured leg, then we centered it, and now we are shifting the body weight slightly on the injured leg. The reason for doing this is slowly the leg has to get used to taking more and more weight. Now if you suddenly start walking without doing this step, what will happen is your leg will hurt, you will start limping, and then the likelihood of you to continue limping will be high. So follow things stepwise. Just gently shift your body weight on the injured leg. Let the leg get used to, the foot get used to that kind of weight. Also, a word of caution, please do this on some soft surface. I've folded my yoga mat and I'm doing it on that, or you can wear your shoes. Don't do it on any hard surface because your leg is still not ready for that. So move, center, move, center, and relax. Practice this gentle tilt towards the injured leg. Do about 10 repetitions to 15 repetitions and do about 4 to 5 rounds of this. This will help you to progressively get used to weight and help you to walk straighter without any limp. The next practice is putting full body weight. So we did the swinging movement where we put little body weight on our injured leg at a time, and now what we're going to do is full body weight. So again, take support. Do not be in a hurry to do anything, and slowly shift your body weight on your injured leg and gently lift up the non-injured leg. Now this can hurt, it might be painful, it might feel uncomfortable, so do as much as you can. Don't avoid it completely, but at the same time, don't push yourself beyond your limit. Take your time, and again, max 3 to 4 rounds, rest, and then you can practice it several times a day. So one of the important things that we need to understand in the process of learning to walk after an ankle surgery is what is the best way to walk. And the best way to walk is heel to your toes. It is never toes to your heels. But what happens, and this happened with me also, is I was so scared to put my body weight on my heel that I started walking with the front of my foot and putting more weight on the balls of my feet and my toes. Now that is completely wrong and can be damaging in the long term. So learning to just put your heel down first and toes. So practice this. Just lift your toes up and gently place your toes down. Lift gently down. So you will learn to put your heel first and then take the weight on your toes. So just a small process. It's a very simple thing to do. Also, the muscles around your ankle will still be very tight. So this will help to release those muscles. So do this again multiple times. Just heel to toes, heel to toes. And we learn to do the same thing in the standing position. One muscle that is very actively involved in the process of walking is our calf muscle. And obviously weeks of being immobile can make the calf muscles little stiff and tight. So simple movement again to release the calf muscle without putting any weight on the body. So here all of this can be done even when you're on a non-weight bearing stage, because I might just place my legs very gently on the mat and I'm just lifting my heel up. So even if you're on semi-weight bearing or non-weight bearing stage, you can still do this. A very simple heel lifts. Do this about 10 to 15 times in one round, and you can do 4 to 5 rounds of this. Remember, each one of these exercises will help you to start walking without a limp. So heal yourself one step at a time. To be able to walk properly, both dorsiflexion and plantar flexion of the ankle is very important. Considering that ankle has been in cast for several weeks or months, this movement this mobility is highly compromised. So it's important to get the mobility of the ankle before you start to walk without support. So here I'm taking full support. I have cushioned yoga mat below and I'm lifting my heel up, planting it down and pushing my knee forward. And when I do that, my back heel gets lifted up. So I'm just practicing this swinging movement, and this is how we walk. So before you begin to walk, practice this multiple times. And same way with the other leg forward. If you're not able to flex your ankle properly, you will never be able to walk properly. Another way to practice this is also your heel raises, lift, down. Activating the calf muscles over here is very important. So again, repeat this 10 to 15 times and do 3 to 4 rounds of this. Now we are at an important stage of our learning to walk after an ankle injury. And many people skip this state because they feel that I'm walking, so what if I'm limping? Let me continue to walk, I'm become independent. But don't do that. Learn to walk first with support. If you take the support, you will be more steady on your feet. Your muscles will get used to the movement, the weight, and you're less likely to suffer from any injury going forward. And most important, you will learn to walk without limping. So take support and walk 10 meters, 5 meters, depending on whatever. Now, most important over here is also you will not walk bare feet. Wear your sports shoes or any shoes which has been recommended by your doctor. No flats, no heels, good sports shoes. Do not walk bare feet. So one leg forward, take your full support. You are very steady, and the other leg forward. So walk with support. Do not skip this step. And the same way you can walk also sideways. So you turn to your side, slowly start to walk sideways. So all the muscles of your legs will be activated. I repeat, do not be in a hurry to get rid of your support. You will end up walking with a limp, and that limp will be then difficult to reverse. So follow these simple steps to ensure that you're able to walk comfortably and without a limp after any kind of ankle sprain, injury or surgery. Please like, share and subscribe to my channel for more such healing content. Let's heal ourselves one step at a time.